Hello and welcome to the Plan for Australia and Personal Relocations live webinar. Today we're talking about wellness before, during and after your relocation to Australia. And I'm so excited to have Dr. Scholtz with me again. Gerda, I know I've been calling you by your first name all the time, so but please, thank you so much for joining us. I really appreciate you giving up your time on this evening in Australia. It's a little bit earlier for you than it is for me, but welcome.
Oh, Robyn, thank you so much. It's such a privilege, and I so enjoy talking to you because we're both migrants and we know what it feels like and we know the concerns. So it's actually nice to compare notes and just talk a little bit about the concerns that the average migrant will have.
Absolutely, and the concerns that they have before arriving. And I think healthcare is one of those concerns that everybody has, and sometimes they just don't get around to dealing with their own health because there's too much other chaos going on. So this is a good time to just take a few minutes out, listen to what we've got to say. Dr. Scholtz, do you want to explain a little bit about your migrant story, where you are, what you're doing now?
Okay, thank you so much for the opportunity. Yes, I am a South African trained and registered medical doctor. I practiced in Johannesburg for 24 years, where I had a general practice, and I also had a weight management clinic. And my husband got an unexpected offer to come to Australia. We didn't expect it at all because we were actually almost over the expiry date for migrants to be able to come into Australia. So we saw that as a miracle opportunity and we just came. I mean, 8 weeks later, he was working in Australia and I literally had no time to prepare myself for this other than just the normal logistics of packing the house up, trying to organize all of that. And then one day I woke up in Australia and all of a sudden, yes, it was a big culture shock for me. Yes. And because I just couldn't, because of Australian regulations, I couldn't just go straight back to practice. You've got to do certain exams and go and work remotely, et cetera, et cetera. I studied and I did a diploma in life coaching because I realized how important the emotional well-being of migrants are because of all the losses and the changes and the stress factors that we go through. And I started doing migration emotional survival coaching. But I managed to continue with the weight management here. So it's a holistic approach. So I try and strive towards getting the body healthy as well as the mind.
Brilliant. Just what people need. I mean, that's just everything in a nutshell. It really is. And I think that's, one of the things that we've been talking a lot about is the stress that your body goes through during a move, and it breaks down your immune system. Stress comes out in various other ways, and people aren't aware of it. And I think that's a lot to do to prepare your body and the children, the whole family, in fact.
The children, yes.
Yeah. Because otherwise everybody lands up sick when they get here. So what would be some of your tips and your information of how people could plan better and deal with the stress that their body is going through?
Mm-hmm. I think if we just understand what stress does to the body, we are created to be able to run away when the lion charges. But when the lion keeps on charging for weeks and months and years on end, all those stress hormones, all those juices that's supposed to help us then becomes the enemy, and it really does something to our health. For instance, the cortisol, the adrenaline, the noradrenaline, the cortisol plays an inflammatory role. So long term, it's not good for the body. And, this is why chronic illnesses start developing and even cancer. So we've got to manage the stress and look after the body. Yes. And I always say, in that preparation for emigration, that's very stressful because of the logistics. It's house and work and visas and paperwork and family and friends and emotions. So you're so busy organizing all of that in survival mode that you don't think about literally the body. Yes. There's just too many admin things to do. But I always say when you're in a tough situation, always start with the basics. The first thing that you've got to do is eat a healthy, balanced diet. And I know these things are simple, But in life, it's about getting the basics right before we can do the rest. If the baseline is not right, you can't build on it. So eat healthy. Obviously, that's my passion in life. But make sure that you stay hydrated, because if you dehydrated, your cells are like raisins versus grapes, and they don't function well. Get sufficient rest. That means you've got to sleep.
Yes, please. The amount of people that text me in the middle of the night and I say, you should be asleep.
Yes.
And I know there's probably a few relocations that might watch this and say, oh, yes, you moaned at me about that. You have to.
It's so important. Adults should at least get 8 hours sleep, let alone children. If you've got kids, go and Google the amount of sleep that they should have. It's something in between 9 to 13 hours, depending on their age. Cut back on your screen time, because screen time before bed, especially in the last hour before bed, you've got dopamine rush and the blue light, etc. We all know about that. And then that also leads to anxiety, depression, etc., eating disorder. So it just adds insult to injury. And then I always say, try and not sweat the small stuff. We can't even add one day to our lives by stressing about stuff. However, we take days of our lives away by stressing, and you can't change anything by stressing about it. That's unfortunately true. I know it's easier said than done, but sometimes when we zoom out a little bit and just focus on the bigger picture, then we realize that.
Yes,
and then
absolutely.
And then you can take care of your immune system by taking the correct supplements, like the vitamin C's, vitamin D. You can have that checked by your GP to see that your level is good, because we tend to slap on the sunscreen, which is a good thing, by the way. I'm not anti-sunscreen, but we've got to check our vitamin D, and zinc is something else. And the other thing that I'm a big fan of is black elderberry. And when we arrived in Australia, I saw that on the shelf. I've got the brand name if someone is interested and wants to ask me privately. And I saw it on the shelves in Australia. I thought, okay, now we're going to be okay. I believe in that stuff for immune boosting, really.
What is it again?
A black elderberry.
Black elderberry. Okay, I'll look out for that.
You even get it in Coles and in Woolworths on the shelves, just by the way. Yes.
So it's an immunity booster.
It's an immunity booster, and when you fall ill and you start taking it immediately, it shortens the duration of your illness.
Okay, good.
I always have in my home. Then the other thing is stay informed about what's going on with your visa and the country that you're going to. Obviously now Australia. Watch the news, stay in touch, because if you know what's going on, uncertainty is something that gives you stress. And if you know where you are now, it relieves the stress. And then obviously, if there's something not well with your health, consult your health practitioner. That's what they're there for.
Absolutely. Absolutely. And I think you make a very good point there about right in the beginning where you were saying, and explaining the different hormones that are running through your body and the dopamine and everything that's going through your body. People underestimate culture shock, and they underestimate how long that's going to continue for. It's not a case of once you get on the plane and you arrive in Australia, everything's good and all that. Your learning curve when you arrive is just so steep. There's so much stress going on in those first few weeks, and if you haven't planned and built up your immune system before you arrive, it's all going to hit you very, very hard. And people really need to not underestimate the length of time that you're going to be under stress. It's not a case of, okay, I've got a rental and I've got this and the kids are in school.
Yes.
The stress is still going to hit you.
Yes. And the thing is, I always say we deal with two processes. The one is immigration. And you think immigration is over the moment you're on the plane. It's not.
No.
Because you may mourn a loss. You may mourn whatever you've had. Okay.
Yes.
Now, the moment you're on the plane, you start immigrating. So there's then another process kicking in while the immigration process you haven't completed that yet.
No.
And the different timelines for both. So I address that with my clients as well, so that they understand these are two processes. Now you combine it with the unknown, etc., etc. So it really takes its toll on a body and a mind specifically.
Absolutely. I think we could talk about this all day because there's so much that people need to know about, and so many underestimate all of this. But what health checks would you recommend people do before they leave home country?
I think this is important. The thing is, once you're immigrating, you don't know what life is going to be like. You don't know what your budget's going to be like necessarily. There are always some unforeseen costs. You don't know about how your health network is going to be like. So try and do as much as possible before you depart. And that means go for a proper medical checkup with your known medical practitioner, your GP. Okay? And then ask for routine blood tests. And then if you are suffering from a chronic illness, have that checked, have the latest blood results, see that specialist. If you are treated by a pulmonologist for asthma, or cardiologist for any heart problems, go to your specialist and have it checked, have the latest pathology done so that you're up to date with that and know what your status is before you leave.
Yes.
And then, ask for your medical records, obviously the relevant ones. If you're immigrating at 35, no one is interested in you fracturing your arm and a clean break when you were 2. So your relevant results or records. And then if you're a lady, have a gynecological check. And if you've got like an intrauterine device for contraception or whatever reason, know when is the expiry date. Should you have it replaced, do that, or removed for that matter. Go for your mammogram if you do for it, if it's appropriate for you. Tick those boxes and know that you're healthy, because you don't need a mammogram immediately when you come this side. So you're buying time, saving money. Your kids' vaccinations, they've got to be up to date. Make sure that they're in place. Make sure that you've got the vaccine certificate, because the moment you enroll them at a school, they're going to say, where's the certificate? So make sure that that's in place. The other thing that I want to tell our viewers is make sure you have your teeth checked.
I was going to say that if you didn't. If you didn't say it, I was going to jump in there, because those dentist appointments, those dentists are expensive in Australia.
Yeah. Like you're donating a kidney to be able to have your... Yes, have your teeth checked, have your dental works done, make sure everything is for the whole family. Let them all go, whether they like it or not.
Yes.
And the other thing that sorry, Robyn.
No, I was interrupting you. I was just going to say orthodontics as well. If you've got any braces or anything on children, make sure you're bringing all the information with you.
Absolutely, because I still wanted to get to that. That's definitely a relevant information. And then, since you're coming to Australia, obviously we're closer to the hole in the ozone layer. Yeah, I recommend people have their skins checked.
Yes.
Skin cancer is a big thing over here. So I think it's good to make sure that everything is fine before you leave. And then, like I said, I'm very much pro the sunscreen. But that's something that you can bring with. You can buy it here as well. But if you buy it in your own currency while you're still in the country, you're probably also going to save a bit of money.
Absolutely. So you've gone to the doctor, you've got your records. Is there anything else that you would say people should bring with them or plan pre-arrival?
Yeah, most definitely. I'm quickly going to say something about a container. If you're bringing over a container, do not put any medication in the container. The one reason is the temperature anyway that the stuff is exposed to is horrendous. So it doesn't go well. Medication will just expire or disintegrate or change. The active molecules will change. The other thing is you also have to declare it. And the moment you say that you've got medication in your container, the authorities will most definitely go and search for it, and you will have a delay in releasing your stuff. So don't create trouble for yourself. Just leave that.
Yes.
While on the plane, it's a different story. Now, the first thing that you need to do is, before you leave, is you go onto the site and make sure what medication is not allowed into Australia. We know certain things like codeine is definitely not allowed, but because it can change, you must check and make sure that you've got the latest, the updated information before you leave. But then a lot of us do have chronic illnesses, and you have medication that you need. So what you can do is you can get 3 months supply from your present health practitioner, make sure that you have a legal original prescription stating that you are taking this, obviously with the records what you're taking it for, and you can take that with you. Yes. And then if you bring extra medication, even vitamin supplements, or maybe, I don't know, headache pills or something like that, make sure that you declare it on the yellow information declaration form that will be handed out to you while you're on the plane. If you've got anything on you that's not allowed and you declare it, at customs, they will just say, I'm so sorry, you can't take this in and take it. But if you don't declare it and they search through your luggage and your baggage and they find it on you, then you're in trouble. And you don't want to start your journey like that.
No, because then it seems like you're concealing it. If you haven't declared it and you haven't told anybody about it and you've hidden it in your shoes, you are concealing it and trying to smuggle it into Australia, and you will be penalised for that. And I think also on the prescribed medications, it's always a good idea not to take that medication out of the original packaging.
True.
So the customs officers often want to check that the prescription you're carrying, so your note from your doctor, your prescription, matches the names and everything on the box. So don't be taking everything out of its original packaging. Keep it in its packaging as well.
Yeah, very, very good point. Very good point. And then the other thing is bring your, like I say, your relevant medical records with you on the plane. No point it's in the container and you need it this side. And then, of course, the important latest pathology reports. If you had a cancer before, you want to bring that information with. The biopsy, histology, etc., so that you can hand it to your doctor this side. Dental records, as we said, with orthodontics, you know, if you've got those imprints for retainers or whatever, so that you don't need to repeat it this side. Should the child lose whatever, as they sometimes do, so that you don't need to fork out this, even more to get the same things done. No, that is very expensive.
And it's just having that history, you know, you want to be able to have a record of your history. And as you said, with bloods and things like that, if you do have your first blood test here, at least you've got a reference from what you had when life was still normal, if you can call it normal. Is there anything else that you would recommend on, you know, because healthcare here is expensive. Some people, you know, don't want to perhaps go into a private healthcare fund to start with. Is anything else that you could recommend where they could save money, or anything else that they should do?
If you are fortunate enough to come into the country with permanent residency or citizenship, then you're obviously allowed to make use of Medicare, which is a wonderful privilege. Yes. Very good health system. And you will definitely then save money. And then when you're looking for a healthcare provider, a general practitioner, it would be ideal to look for someone who's doing so-called bulk billing. Now, that means when you visit your doctor, whatever they need to do is they do it under that umbrella of Medicare, and then all the cost will be then claimed from Medicare, and you don't need to pay extra. Correct. However, you do get practitioners who do what they call split billing.
Okay.
Or what's the other terminology? Is it split billing? Yeah, I think split billing is what they call it, where you have to, for instance, the consultation fee is higher and you will have to pay an extra $20.
Yes. Yeah.
So, yeah, and that's why you need to look for bulk billing. That's the terminology. And then in terms of medication, there's a pharmaceutical benefit scheme, which is a subsidized medication when you use chronic medication, where you pay less. So make sure that you use one that's on the scheme. You can ask your healthcare professional to prescribe rather something that's on the benefit scheme.
Yes. And don't be afraid to ask those questions. Some people are, want to be referred, but don't be afraid to say, I need to be referred to bulk billing, or I need to be referred through Medicare.
Yeah, do that. Then the other thing is, when you need any specific care or service, you can always go and search and compare healthcare providers, hospitals, etc., because the fees can differ, and make sure that you then get something that's more affordable for you. And then I want to say something. We spoke about immunity, but you know what? prevention is cure. It's much better. You know, if you've got a small legal, have it sorted before it becomes a big thing.
Yes.
You know, try and save like that, especially with the kids. Watch them, and if you see there's something, address it quickly. Don't wait until there's big drama. And then in terms of health insurance, it's actually because if you are not allowed to use Medicare yet, you're obviously going to be forced to have your own health insurance. It will probably be part of your visa conditions. And then you have to make sure that you've got private health insurance. And it's almost as simple as typing into Google, compare health insurance in Australia, and it will come up with different sites where you can actually either speak to a consultant, or it will let you put in what your needs are, and it will throw out different healthcare providers or health insurance providers with the different benefits and what the costs are. So that is absolutely possible. So do that.
And even when you're getting quotes on your health insurance, know that there's so many different packages. I mean, even for ourselves, when we relocating somebody and they say how much for our health insurance, it's not something we can really quote on, because there are so many extras that you can add on, and you can chop and change plans. So even when you're getting those plans, shop around, do your homework on them, see what you're going to need. If you've got primary school kids, you're going to want to put dentistry on there, and maybe physiotherapy if they're very sporty. So you can build plans in Australia with your healthcare.
Absolutely true. Then just coming back to medication, also don't be scared or shy to ask for generic medication.
Yes. Explain that a little bit more.
Okay. Generic medication, I think a lot of people may be familiar with it. So when a medication is launched, they have a patent registered where they can only sell it under this specific brand name for an amount of years. I think it's 20. I may need to be corrected. But then when that patent expires, other companies can also make that kind of medication under a different name. And then quite often they can make it cheaper, or they will ask cheaper for it because they didn't put the research into it. They didn't have the expenses. And you are welcome to ask for it. Your doctor will, or even when you go to the pharmacy, they can replace whatever, or substitute is the word, not replace, whatever is on your script for a generic equivalent, which can save you money, especially if you've got to pay it out of your pocket.
Absolutely.
And then there are also things like community health centers. Quite often there are centers that offer certain for free services. You can just Google it.
Yes, especially when it comes to maternal health and children, and even the children's immunizations. I often say to families when they've arrived to just go along to the maternal health in your local council and do your immunizations there, because one, you can get in there a little bit quicker, but also the nurses are very up to date with catch up if you need a catch up program for the immunization. So that's a very good tip for saving money.
Yes. And then if you qualify, take advantage of healthcare concessions. If you are eligible for it, you can apply for concessions and government assistance. And sometimes especially if you've got a special needs child or person in your family, so have a look into that. And then sometimes the government has initiatives or drives for something specifically, women's health or mental health, etc. And there will be special offers or for free services. So make use of it if it's relevant to you.
Yes, and definitely. And I just wanted to nip in there, because if you're watching even on your local council, you'll be able to see that they might be having a breast screening truck, or they have, they have different mobile services, and even in the rural areas where they'll have people coming out, and there can be all sorts of screenings that can be done in a mobile setting, if you like.
Yes, and why not make use of it? Because it's high standard. It's really not. It's really not inferior. You can really make use of it.
Absolutely.
It's almost the same as going for a Medicare check.
It's
just easier available for you.
Absolutely. And I think that just brings me on to my last question. Is there anything else that you could recommend of where people can get help, how they can get help, things, where should they start if there is a starting point in all the chaos?
Yes. I'm just quickly thinking back of the kids, which I want to say that something else that you can bring on the plane is bring a basic first aid kit. Because I know you can buy plasters, etc. in Australia, but bring it along, especially if you've got children. Accidents happen. Could be your first evening in the rental and then someone needs a plaster and then you don't have it. Just pack those little basics. Or you may burn yourself cooking and then you don't have anything. So you can bring that in. You just mention that on your declaration.
Yeah. And familiarize yourself with our emergency service telephone numbers, 000, et cetera, know what those numbers are. I have had relocations who have been here for less than 24 hours and needed an ambulance. So you do need to make sure that you're very aware of what might happen. And I know there's a lot going on, but these things can really trip you up if you don't plan for them.
Yes, because you feel lost. You're literally in a foreign country. So yes, do that. That was one of my tips, but thank you for mentioning it. So the number one gatekeeper in health is always your general practitioner. So I would suggest find out, get a recommendation from a friend, who is your closest, etc. And that's always your first point of contact for non-emergency care. Okay, so if you've got a chest pain and you think you've got a heart attack, don't go to your GP. Remember, a doctor is just as good as his or her tools. Yeah. And a GP does not have an ICU if you need to go to ICU quickly. So don't take your husband or your wife there. Then you go to the emergency department or you phone the ambulance. So make sure that you know where is your closest. Okay. And then also there's an after-hours service called Health Direct. I won't give the numbers now. That's also something that you can look for.
Yeah, some of them are state-specific. So here in Victoria, we have nurse on call, and you can phone a nurse 24 hours, 7 days a week, explain your symptoms. They will then say to you, okay, you need a GP, or this is your nearest medical centre, or they'll get a doctor to come to the house if necessary. So yeah, it's very state-specific.
Okay, but that is such an amazing service. Yeah. I mean, we didn't have that in South Africa.
No.
Okay, and then obviously I said you need to know where your closest emergency departments are. And if you need a specialist, you need a referral from your GP. I think most people are familiar with that kind of system. You need to see your GP, and your GP will do the necessary tests and then sort out a referral to the relevant specialist that you may need. And then there are also very good mental health services here. There are things like Lifeline and Beyond Blue with their specific numbers that one can phone. And I think it's important for migrants to know that. There are all sorts of different support groups on Facebook. Once you in the country and in the town or the city that you live, find out what are the support groups for the different kind of health problems that you may have. And join those groups, because they will also be quick to say to you, you've got to go there, this hospital, that specialist, this GP, or this nurse, or wherever one can, would need help from.
Yes, and don't be afraid. Again, those things are there. The support is there. Don't be afraid. Reach out.
Yes. And then something, obviously, remember pharmacies. You can have your blood pressure checked there. A lot of them also do certain vaccinations or small little things that you need small help, or opinions, or just, bounce it off the pharmacist and he will say, okay, you can try this, or rather see your GP. I think you need more than just what I can give you.
Yes.
And then there's, of course, the other thing that came with COVID is the telehealth. If you know that your doctor doesn't need to examine you, or this is not a more serious thing, this is a small thing, use that from the comfort of your home. Yes, especially maybe when it's a chronic problem, or that if you can monitor your blood pressure yourself and you have a question, make use of the telehealth.
Absolutely. There's lots of different avenues, isn't there?
Yes, and this is the beauty of coming to a first world country. There's so many options, and the system works.
Yes, absolutely. I know we have a few British people that are also looking at it. So our Medicare system is based on the NHS system. It's very similar to what you have in the NHS. Having lived in the UK myself for 10 years, and I've relocated many doctors, nurses over the last couple of years especially. I know that in the UK you're working very long hours, and perhaps that's why many of you have relocated to Australia, for a better work-life balance. But I would say that the stories that I'm hearing now, it sounds like the NHS is under the pump, let's say. The Medicare that we have here and the health facilities that we have here are very much in line with what I experienced in the NHS 15 years ago. So if you were comfortable in the UK 15 years ago, you'll be comfortable here too. And as British citizens, as well as Italy, Netherlands, there's 7 different countries that actually have reciprocal agreements with Medicare. So even if you arrive here on a temporary visa or a working holiday visa, you are eligible for Medicare support because there is a reciprocal agreement in place. So just for those that are coming from other countries, be assured, I mean, as Dr. Gerda says, your GP here is in control of everything. They're sitting in the driving seat. Everything must go through them for a referral. But there are so many ways to get support, whether it's mental health, whether it's dentistry, as we said, just even having breast scans. All these things are so important. You can look out for them in your local council. You can get rebates. There's lots of opportunities. You've just got to keep your hand on the pulse of all of them.
Yes, I also worked in the UK, but I worked in the private system. So for our British viewers, it's very similar, especially if you look at your private health insurance. The system is more or less the same, I would say, like you also said.
Yeah, very, very similar. And the same thing, if you go to the hospital with an emergency, whether it was in the NHS or here, you might wait with some emergencies, but the care you get, you will feel very reassured that you're being well looked after.
Oh, absolutely. I had an emergency with an eye, and I was really, when we were fresh in the country, and I really had such good service. And then I was amazed afterwards. I said, so where do I pay? And they all laughed at me. It was like, wow, I had all of this done and I don't need to pay for it. Wow, I was really impressed. I had very good care. Having a medical background myself, I know I had good care.
Yes, that's very comforting. Thank you so much. Is there anything else that you'd like to share? Any sort of hot tips that you might have skipped along the way and thought, oh, I didn't say that. Is there anything else that you wanted to cover?
I think the most important thing is that we should look after ourselves in a holistic way. And like I say, when things go wrong, always get the basics right first. And I am a strong believer in enough sleep, as you said. You have to sleep.
Have to sleep. You have to build up that immunity. You have to know that it's a long haul.
Yes, the lion is charging for quite a while when you do migration, but eventually the lion gets tired and you grow stronger. So
yes, the tips in your favor.
Yes, absolutely true.
Thank you ever so much for your time. I sincerely appreciate it. It's always a delight to talk to you and always insightful. And every time I speak to you, you just give me so many more nuggets of information. I just love it. Thank you ever so much.
Oh, thank you so much, Robyn. It's an absolute privilege. I love helping my fellow migrants because I know what it feels like.
Yeah, and you know what's coming.
True, absolute true story. I know the emotions and the feelings, absolutely.
Yes. And of course, people can get in contact with you, either before, I'm suggesting, but certainly after they've arrived in Australia and just, tell us a little bit about the work that you're doing, in your holistic approach of looking after not just migrants, but people in general.
I'm based in Perth, but I do the migration emotional survival coaching online. Also for convenience, you don't need to leave, and it's so I do specific little programs depending on where the immigrant is coming from because of our different backgrounds and cultural inclinations, etc. There's certain things that I understand, and then I focus on that.
Okay.
Yes, so I do that online. They can always contact me via Messenger or via my email or my Facebook. But then I also have a weight management clinic, which I do face-to-face, but also online. I have people in New Zealand, over East, in Utah, in South Africa, London, where I help them with their weight. Yes, online as well. I've got specific little things that I do with them, and it's so nice for me to see when they're successful.
Brilliant. Yeah, carry on.
No, I just want to say a lot of emphasis on the emotions, on the brain patterns, whether you're doing migration, whether you need to eat healthy. Your brain can be your absolute enemy, but if you know what to do with your brain, it can be your strongest organ and weapon against everything in life that goes wrong.
That sounds like the next webinar, doesn't it? Using your brain as the weapon.
Okay, deal. I'm keen.
Using your brain as a weapon. I like it. I like it a lot. Would you say if people are looking for not mental health support, but looking for some of the, I guess mental health support or just migratory coaching, should they contact you before they arrive or only once they arrive and start stressing even more? When's a good time to start?
I love to start with them while they're busy with the emigration before they left, because there are already things that they need support with. But I know quite often they don't even think about that. They go in survival mode and they just look forward to the day that they can get on the plane. And I get that. That was the case for us. We had no time for the preparation. Hence, I understood how important it is to do that preparation, because when we landed this side, it was like a massive vacuum for me. It was such a culture shock. And I don't mean that the Australian people shocked me. That's not what I mean. It means that who I am, and now I am in a different country where things work differently, and I don't have anything here that's similar to what I was used to all my life, all my professional career, with friends, networking, from medical network to professional network to just your local community, school, church. Whatever you do, you don't have that anymore, and it's different.
No, especially from you coming from such an established career, you were very comfortable in what you were doing, to just uproot everything and start all over again.
I always tell this at my own cost that in South Africa, I did a bit of television work. And then when I came here, not even the neighbor knew my name. Some days, you wake up and then you think, am I still who I am? I think I am. So that's part and parcel of, that's why my business, the name is UNBecoming, because you become something in your society, in your career, in your community. And then all of a sudden, you don't have any of that when you come here. So I call it
Love it. Absolutely love it. I think it's just frozen on you. I'm just going to see if you come back. But while we're waiting for Gerda to come back online, if she unfreezes next to me, there we are, you back.
Oh, I've lost you for a second there.
That's okay, it froze. But you were just talking about the name of your business as being UNBecoming and what that meant for you. And that's where you froze. So you became a frozen statue.
But I think that is something that's very relevant, especially for the partner of the person who's got the visa. Because normally a family comes over on one person's visa, the others tag along. They're very fortunate if they can just immediately jump into the working stream and just continue with life as it is. I think it actually, as it was, I actually think that will help. But sometimes, especially the mother or the caring partner who looks after the family, whose main role it is, it's sometimes perhaps necessary to take a bit of a breather and just literally nurture the family and care for the family while everyone's just finding their feet. There's a place for it as well, for someone to be at home, especially with kids.
Yes. Okay, so if you're watching this, don't underestimate your health. Don't underestimate taking a holistic approach with your health, preparing before you arrive. Get in contact with people like Dr. Scholtz, who can just give you a bit more information and support around your mental health and preparing yourself for that move, because it's not just, as we were talking about, the immigration and the emigration, it's a long haul, and it's putting your body through stress over a long period of time, you know, from the time that you start processing all that paperwork for your visas all the way through to getting the kids in school and thinking you're back to routine and this is now normal life. That could take 3 years. That stress builds up in your body. It's not healthy, and you really need to pay attention to it, please.
Yeah, absolutely.
Yeah. Thank you so much for your time, Dr. Gerda. I really appreciate it. I appreciate you giving up this your evening with your family. So thank you very much, and for all your information. I really appreciate it.
Thank you very much, Robyn. Thank you for inviting me. I always enjoy our talks. Thank you very much. I hope to do this soon again.
Yes, we're going to do the brain one.
Okay.
What did we say?
The brain is your best
brain.
weapon.
Yes, that's it. We've got it. Next one.
Okay.
All right. Thanks so much.
Okay, Robyn. See you.